morning. My name is Tharada Phuttharak, a fifth-year medical student from Kaen University. I will be presenting my research on identifying essential 21st century skills, insights from medical specialists in OBGYN, internal medicine, surgery, and pediatrics at a tertiary care hospital in northeastern Thailand. 16 important 21st century skills were reported as needed skills for every student in the century of technology. In modern healthcare, technology isn't just a tool, it's changing how we save lives. This means medical education must expand to include a broader array of competencies. However, these skills don't appear overnight. This is the concept of longitudinal skill development. Research shows that diagnostic accuracy takes over 10 years to peak, meaning education extends beyond graduation. Currently, our students are active and our faculty tracks their skills development progress via MDKQ Live application. But despite the system, we lack a specialty-specific roadmap. Students are collecting data without knowing which skills to prioritize for their future career. To build this roadmap, we designed a framework to survey experts across the 4 pillars of medicine: OBGYN, internal medicine, surgery, and pediatrics at a super tertiary care center, Kaen Hospital. Our objectives were to identify the must-have skills for each major specialty and analyze how these priorities change with experience. Ultimately, we aim to transform this data into a strategy that helps students develop skills and make informed specialty choices. We conducted a cross-sectional study at Kaen Hospital, ending in January 2025. We targeted 225 specialists, asking them to rate skills on a 5-point Likert scale. Data was analyzed using SPSS with full ethical approval. We analyzed responses from 39 specialists. Nearly half were from internal medicine, followed by pediatrics, and then an equal split between surgery and OBGYN. The gender distribution was fairly balanced, with an average age of 38 years and a mean practice of 11 years. We categorized score into high rating, which is 5, and low rating, which is any score less than 5. When we look at the total score of each skill, communication skills are rated the highest, followed closely by collaboration and critical thinking. Literacy and adaptability skills are among the top 5. But surprisingly, numeracy skills are overall scored the lowest among all 16 skills. Breaking this down by specialty, we found a statistically significant difference in literacy. Surgeons place significantly less emphasis on literacy compared to other specialties. And though not statistically significant, we saw trends where pediatricians emphasize numeracy while both pediatricians and OBGYN prioritize adaptability more than others. When looking at experience, we observe a significant positive correlation in scientific literacy. The senior specialists rated this much higher than junior colleagues. But conversely, for collaboration, the trend flipped. Junior physicians rated collaboration significantly higher. And in general, we observed that senior specialists gave higher ratings to almost every skills, except for adaptability and collaboration. So let's look at the discussion. The high ranking of communication and collaboration across all specialties aligns with the importance of inter-physician teamwork. And we found that numeracy was ranked overall lowest. This suggests that while physicians feel numeracy is less important, it remains important in medication errors. And senior specialists value scientific literacy more, reflecting the growing recognition of importance gained with experience. When looking at each specialty, surgeons place less emphasis on the literacy skills, align with the priorities of the non-technical skills for surgeons framework. Pediatricians rank numeracy the highest, consistent with the critical role of precise dosing calculations in pediatrics. OBGYN and pediatricians emphasize adaptability, likely reflecting the variety of work and the emergency conditions both require to manage. And lastly, senior specialists place greater emphasis on most 21st century skills, indicating increased emphasis throughout the professional experience. In conclusion, our study confirmed that communication and collaboration are the non-negotiable skills required across every major specialties. And we were able to identify the specialty-specific skills. And lastly, a doctor's priorities shift and mature as they gain experience. Finally, we acknowledge the limitation of this preliminary study. Being a single-center survey with a small sample size, our results may not fully represent the general medical community or other specialties. We plan to expand to collect data from more hospitals in Northeast, conduct in-depth interviews, and develop a pilot program, then track students' outcomes. That concludes my presentation, and thank you for your attention. I am happy to answer any questions.
Such an interesting topic. Do you have any questions?
Very interesting indeed. You said that the participants in your study are 39 participants, right?
Yes.
And how many staffs and how many attending staffs in clinical year of 4 major departments in Khon University?
We look at those numbers, and it's 225 staff in the 4 major specialties.
So how many percent, just approximately?
The response rate, it's like roughly like 15%, 10%, yeah.
Because I think it's quite interesting in your conclusion, and I think, regarding, because I'm pediatrician, so it's very correct about numeracy skill, but other skills I just wonder because it's quite, because your participant in the study is quite, I think it's quite small number to conclude, so I think it's maybe beneficial if you expand your study, especially into other contexts, like community hospital or something.
Okay, thank you for the suggestion. We acknowledge our limitation that the sample size is quite small, and even though with the small sample size, we were still able to see some significant information and some interesting trends within the results. So we plan to expand the study into more hospital in Northeast area in Thailand.
Thank you for your presentation. Your results show specialty-specific variation in skill prioritization. How do you interpret this difference, and how might they inform curriculum design? Tailoring for medical students across the different clinical fields.
Could you repeat the question again, please?
Because you just correct the data from the like a specialty, many specialties that have the skill prioritizations. So how do you interpret this difference? How might they inform the curriculum design or something else?
So we were able to look at some of the top prioritized skills. I think those are beneficial for integrating into extracurriculum and also the curriculum itself. So we can design some extracurricular activities that promote more communication and collaboration for the students, or we can emphasize that more in the curriculum itself. And also for the specialty-specific skills, I think we could if we collect more data and can conclude more of that to more solid, we can improve our data collecting, the skill development data collecting system, and arrange all the 16 skills, and then we can also give like the information for the students that like for each specialty from the study, which one is like more prioritized skills, so the students are informed. So if they were interested in going into a specific specialty, they can focus more on some of the skills in all of the 16 skills, because 16 skills are quite overwhelming for the students.
Thank you very much.